Welcome to What Do You Know YouTube channel, your ultimate destination for accurate, insightful, and diverse knowledge. Here we explore fascinating topics from around the world, breaking them down into clear, engaging, and easy-to-understand content. Whether it's science, history, culture, or everyday curiosities, our mission is to enlighten, inspire, and keep you informed. So if you're a curious mind seeking reliable information, you're in the right place. Subscribe now and let's uncover the world of knowledge together. Human Metapneumovirus, HMPV, Outbreak in China. An in-depth analysis. In the winter of 2024-2025, China has experienced a notable increase in cases of human metapneumovirus, HMPV, a respiratory virus that has garnered significant attention due to its impact on public health. This comprehensive analysis delves into the nature of HMPV, its epidemiology, clinical manifestations, diagnostic methods, treatment options, preventive measures, and the broader implications of the current outbreak in China. 1. Introduction to Human Metapneumovirus, HMPV. Human Metapneumovirus, HMPV, is a single-stranded RNA virus belonging to the family Paramyxoviridae and the genus Metapneumovirus. First identified in 2001, HMPV is recognized as a significant pathogen responsible for acute respiratory tract infections across all age groups, with a pronounced impact on young children, the elderly, and individuals with compromised immune systems. 2. Epidemiology of HMPV global prevalence. Since its discovery, HMPV has been detected worldwide and is considered a leading cause of respiratory infections, second only to respiratory syncytial virus, RSV, in pediatric populations. Seasonal outbreaks typically occur during the late winter and early spring months, coinciding with other respiratory viruses. Outbreak in China 2024-2025. In December 2024, the Chinese Center for Disease Control and Prevention, China CDC, reported a significant rise in respiratory infections attributed to HMPV. Data from the week of December 16 to 22 indicated that HMPV accounted for 62% of positive respiratory illness tests and 4% of hospitalizations due to respiratory illnesses, surpassing other viruses such as COVID-19, rhinovirus, and adenovirus. The increase was particularly notable among children aged 14 and under, especially in northern provinces. Clinical manifestations, symptoms. HMPV infection presents with a spectrum of symptoms ranging from mild to severe, including mild symptoms, cough, nasal congestion, fever, sore throat, fatigue, severe symptoms, wheezing, difficulty breathing, bronchiolitis, pneumonia. AT. Risk populations. While HMPV can infect individuals of all ages, certain groups are at higher risk for severe disease. Infants and young children, elderly individuals, persons with underlying chronic conditions, e.g., asthma, chronic obstructive pulmonary disease, immunocompromised individuals for transmission and pathogenesis transmission. HMPV is primarily transmitted through respiratory droplets when an infected person coughs or sneezes. It can also spread via direct contact with contaminated surfaces, followed by touching the face, particularly the nose or mouth. Pathogenesis. Upon entry into the respiratory tract, HMPV infects the epithelial cells lining the airways, leading to inflammation and the clinical manifestations associated with the infection. The incubation period ranges from 3 to 6 days. 5. Diagnostic methods. Laboratory diagnosis. Accurate diagnosis of HMPV involves several laboratory techniques. Reverse transcription polymerase chain reaction, RT-PCR, detects viral RNA with high sensitivity and specificity. Direct fluorescent antibody, DFA. Testing identifies viral antigens in respiratory specimens. Viral culture, less commonly used due to longer turnaround times. Differential diagnosis. Given the overlap of symptoms with other respiratory viruses such as RSV, influenza, and SARS-CoV-2, differential diagnosis is crucial for appropriate management, treatment, and management supportive care. There is no specific antiviral treatment for HMPV. Management focuses on supportive care. Hydration. Maintaining adequate fluid intake, antipyretics, to reduce fever. Oxygen. Therapy. For patients with hypoxemia hospitalization, severe cases, particularly those involving respiratory distress or complications like pneumonia, may require hospitalization for advanced supportive measures. Prevention strategies, infection control measures. Preventing the spread of HMPV involves standard respiratory infection control practices. Hand hygiene, regular hand washing with soap and water. Respiratory etiquette, covering mouth and nose when coughing or sneezing. Surface disinfection, regular cleaning of frequently touched surfaces. Vaccination. As of now, there is no licensed vaccine for HMPV. Research is ongoing to develop effective vaccines to prevent HMPV infections. Pub.